Let's go to our chief political correspondent, David Akin, in Ottawa. David, the Prime Minister and the Premiers agreed last night to develop national guidelines on reopening the economy. What do we expect from these guidelines?
Well, you know, I think the best way to start is compare and contrast to what we're seeing, say, south of us, where the U.S. president has clearly been at loggerheads with some U.S. governors on when and how and what's going on with reopening. Nothing like that, I'm told, here in Canada. Everybody is parking their partisan hats at the door, and they had a very good discussion last night. In fact, most of the teleconference, that's how they met, most of the teleconference yesterday was about how this is going to work. So some things that I think everybody agrees on is there's got to be the ability for provinces to be flexible in terms of setting their own agenda on when to open and what to open. And earlier this week, we've already seen Saskatchewan Premier Scott Moe lay out his province's 5-phase plan. New Brunswick's Blaine Higgs laid out a plan yesterday. We expect to hear Ontario and Quebec talk about their plans next week. So that's important, that provinces have their own flexibility. And then there's got to be some common denominators about best practices. One of them has got to be ramped up testing capacity. And in this, we take a look at Saskatchewan, why they were able to be first out the door. Saskatchewan and Alberta are the top two provinces right now in terms of the number of tests they're able to administer relative to the population. And so that's very important, that provinces can do rapid testing and lots of testing, not just of healthcare workers, but anybody who's out there in the economy. Ontario is still among the laggards, and this will be one of the factors that is going to prevent or hold back Ontario getting around to reopening. Ontario really needs to do more on its testing. But here's something else, Robin, that I think that we're just starting to catch up on now, and something the Premiers talked about last night is, when businesses open up, businesses are going to want to have protective gear for their employees, masks or shields, possibly gowns. And we know that right now it's tough enough for our frontline healthcare workers and those caring for people in seniors' homes to get all the gear they need. So this is going to put a real strain, I think, on the supply and demand system for personal protective equipment. It's something the Premiers acknowledged last night, and it too is going to have to factor into plans for provinces as they open up industries and open up the economy. Can workers stay protected and get the gear that healthcare workers also need?
But David, are the provinces counting on the federal government for the PPE?
Pretty much. It's a collaborative approach here. And so we know that there's lots of domestic response to getting PPE. In fact, yesterday we learned 26,000 firms put up their hands when the call went out to say, hey, we can make stuff. We've got Stanfield's, the underwear maker out in Nova Scotia, ditching the underwear line. They're making hospital gowns, about 100,000 hospital gowns a week. We know that the GM Oshawa, this is a car plant that was about to shut down. GM was going to shutter it, and that was going to be the end of that. Well, hold on. They're going to retool at that plant, and they're going to be churning out 1 million masks a week. So that's great. But that's still nowhere near the demand that Canada and the provinces have. The federal government is out there in the international marketplace buying in bulk on behalf of the provinces. And we heard about this yesterday. When Canada goes to the international marketplace and says, yeah, I'd like 100 million masks, the size of that order gets everybody's attention and allows Canada to be at the table in what is a very competitive environment. So we still are going to have to source stuff from overseas. We're sourcing stuff from China. That's one of the places where most of the world is getting a lot of their protective gear. The federal government has leased a warehouse in Shanghai, and we're about to start shipping about a plane load a day from that Shanghai warehouse to Canada. When stuff comes to Canada, it's got to be inspected to make sure it meets Canadian safety standards. We saw last week 1 million masks from China did not meet the standard. Apparently there's something wrong with the rubber band that goes around your ears. And the Chinese supplier is going to make good on those. No expense to the Canadian taxpayer. But that's the sort of thing the federal government is involved in right now, buying internationally on behalf of provinces, and then it goes to where it's most needed. It's not on a per capita basis. It goes to where it's most needed, and it's by and large public health officials sorting out where that goes.
You talked about the taxpayer funding all of this. What is the bill for all of this?
It ain't, well, like everything else these days, it's not cheap. These flights, just the flights alone, not the stuff inside the planes, the flights alone are costing between $600,000 and $800,000 each. So every time a plane comes over, that is the bill. Right now, there's just two airlines that have the federal contract, Cargojet and Air Canada, though the federal government, federal officials yesterday saying other airlines like WestJet, Air Transat, they're trying to qualify them again to be able to go into China and to be able to bring stuff back. So there's a lot of cost. And then once you start talking about the actual gear, I mean, it's just supply and demand. If you wanted to buy an N95 mask back in January, you were looking at about $1.20 a mask. Now you're looking at about $6 a mask. So think about that. And again, we're buying these things by the millions. I mentioned the federal government has orders out there for more than 110 million masks. That's just masks. And then we're talking about ventilators and gowns, you name it. So the cost of everything has gone up, and that is just flat out supply and demand in an incredibly tight marketplace right now.